How to tape you next time too. So because of your tendon, the scar is like pulling you this way. So what we want to do is we want to shift you over, right? And we want to actually, the scar feels good this way or this way. Go this way, right? So what we did was we wanted to pull the scar this way, right? So I cut 2 squares and I cut them in half. Wait, did I use it? No. I cut it into thirds, 2 squares, and I cut it into thirds. And I wanted to tape from the top down. Right, from the top. So I'm gonna try to shift you over. I'll put tension on it. Right. Did it feel good over the weekend? And I kind of like crisscross. Based on the pull of the scar this way. Okay. Alright, so I'm gonna pull it. I'm gonna pull the tape. Right? How's that?
Yeah.
Does it feel good on the scar? Because it feels like it's pulling your scar this way, right? Perfect. And the other thing we did was, because this joint is shifted this way, we want to shift it back, right? We want to shift it and kind of rotate it back because the scar is just pulling. So we want to hold that position. So we need the tape to like kind of scrunch you right here. So that's why I ended up using a thicker piece to pull it, right? And so we're gonna put it to the side. And I'm gonna reposition, rotate, and give it a lot of tension. So all of the tensions were, this is probably about 50% tension, but this one was probably more because I wanted more of a pull. Right? Yeah. How's that feel? So were you able to do more stuff over the weekend? Awesome. With the tape it just felt, because usually you have pain right here, right? Not all the time, but sometimes, right? So you could feel it in the joint deformity, like when I could pull and reshift, because this bone, this joint, is supposed to have a little bit of give, but not like a lot. And right now you have a lot. Yeah. So, and then the scar, you see how my skin lifts up like that? Your skin lifts up like that too. And right now, because of the scar, it's like sucked down. So depending on how your person is scarred, you would test it. I'm gonna pull it this way towards the end. And if that feels good, then I'm gonna tape from the distal to the proximal. If I go like this from distal to proximal and it feels good this way, then I would tape from proximal to distal. I would pull in the direction that feels good to you because that's the way it's gonna keep pulling, right? So everyone who comes in with a scar is different. So I just test it based on what feels good to give that support and to give that give. And then if I'm thinking that there's a joint deficiency with how it's pulling, then I'm gonna shift it to a side that feels good too. Because if I can help his hand feel good and then support it, it's gonna help him to exercise better, right? That way it helps the joints, like it's like he's like this right now, right? His joint is crooked. He's not crooked. It's like this, and now we're gonna put it back in place, and then we're gonna hold it so that we could move it better, right? How's that? Probably need a little bit more rotation, or this. That better? Feels good? All right, let's do a little bit of putty and see if it feels like good doing it.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.